I'm Glenn Wood.
And I'm Richard Tadamir.
We are psychotherapists based out of British Columbia, Canada, and you're listening to Deliberating Practice.
In this podcast, we deconstruct everything from the foundations of therapy to its newest innovations and horizons.
We take a critical perspective on contemporary issues that affect therapists across the world. We share our own stories, both personal and professional, and sometimes we talk to other therapists too.
We hope that this podcast can be like sitting with the trusted mentor you always wish you had, helping you integrate and make sense of our complex and exciting field.
So sit back, relax, and enjoy the episode. For resources, show notes, and to work with Richard or Glenn for supervision, consulting, or counseling, go to deliberatingpractice.com. Hey there, Richard.
Hey, Glenn.
Good to be with you again tonight.
Good to see you too. I'm excited about our topic today.
Yeah. We're talking about doing drugs tonight, aren't we?
Absolutely.
We're talking about getting high.
In a safe and responsible way.
That's right. That's right. Richard, what's our topic for our listeners?
It's psychedelic assisted therapy.
The good stuff.
Mm-hmm.
And you're a bit of a guy in this. This is kind of your baby, isn't it?
I'm very excited about it. Mm-hmm. And yes, have delved into it for the last couple of years in particular, both personally in my own psychedelic work and with clients and with a lot of training before and throughout. Yes.
Break that down for me a little bit. What has that been like for you?
It's kind of been a journey of realizing I was kind of plateauing a bit in individual therapy. So that was kind of my first experience, and undergoing a psychedelic experience with someone a trained therapist. That really helped me move through and move deeper. Out of some childhood trauma and other trauma reactions that I was stuck in, which moved me then into training. So training with Therapsil, they have quite an intensive course. It includes some practical components, supervision components, and that's with the psilocybin, and a lot of their use is around end-of-life distress, and then also treatment-resistant depression, PTSD, etc. So understanding that context, and then joining something called the Gathering Groups, gatheringgroups.ca, and they are basing their model off of some work at Vancouver Island University, some consulting with Indigenous people around Sumas First Nation, with VIU, etc., Roots to Thrive. And originally that was ketamine with Roots to Thrive, and then the Gathering Groups is psilocybin, and it's a group-based model with a bunch of Zoom before, where there's no psilocybin, and then there is a dosing day with psilocybin and good. So there's great prep and great integration after.
Wow. So you've been both a user and consumer of psychedelic assisted psychotherapy. We might say you've been assisted, and that really led you into practicing it as well.
Yes.
And Richard, as we prepared for this episode tonight, we really talked about the idea of needing to set the context, that if we're going to talk about psychedelic assisted psychotherapy, we need to kind of acknowledge some of the important contextual components of the use of psychedelics, and to acknowledge our location in this. What does that look like?
Yeah, that's critical to start with our heart from the right place. I know that's important for both of us. So recognizing that we're both white settlers, and the use of psychedelics, especially like plant-based medicines like psilocybin, have been used for centuries, if not millennia, in indigenous tribes in areas like Mexico, etc. And we really want to honor and respect the very powerful spiritual traditions, connection to earth of these medicines.
Yeah, we're really talking about just one particular way that these medicines are being used in our contemporary healthcare setting even, and that's a vastly different way than the way that these have been traditionally and historically used. And we don't want to ignore that context. I think it becomes important later in our discussion about the appropriate use of these medicines, and highlights one of the problems that exists in our current space of psychotherapy. But we'll jump into that later. Maybe we can start, Richard, by giving our listeners a good, clear sense of what psychedelic assisted psychotherapy actually is. What is it, and how is it different than conventional talk therapy?
So, psychedelic assisted therapy, or PAT, is a treatment often used for things like treatment resistant depression, treatment resistant PTSD, end of life distress, in terms of the medical or psychotherapy context that we're discussing. It has a wider use with creative problem solving, with conflict resolution, a lot of other things used in other contexts, indigenous and in Silicon Valley, etc. But for talking about PAT, we're looking at often several sessions of prep work. So that looks kind of like traditional psychotherapy. Sometimes we're using things, especially a lot of focus in like grounding techniques to help calm the nervous system, things like EMDR to help the person process some triggers. So there's a prep phase, there's then a dosing phase or the active phase where one, let's say for psilocybin, undergoes a journey with typically golden teacher mushroom, about 5 grams. And this is kind of what's a heroic or therapeutic dose recognized in a wide amount of clinical trials. And this results in an ego dissolution event, ideally, which basically means a person has an opportunity to see their life and trauma and experiences from kind of a 30,000-foot view, maybe for the first time, lower their defenses, and break through maybe many plateaus they've been having in traditional talk therapy. And then it's followed by an integration phase where how do we integrate all of the wonderful insights that we've had and the challenging parts of the experience, the beautiful parts of the experience into our everyday life and into action, whether that is I'm going to dance more, I'm going to be able to communicate with my partner better, I'm going to feel less triggered and I know why I'm triggered and now I'm able to manage that a lot better, maybe hopefully with a lot less effort as well because of the increased neuroplasticity that the experience gives us.
Right. So in some ways, psychedelic assisted psychotherapy is similar to conventional therapy in that there's a therapeutic relationship built and there's some talk therapy sessions that are incorporated into the process. And what differentiates it from other therapies is the use of psychedelics at some point in the process to facilitate, as you described, a kind of deepened understanding of oneself, dismantling of the defenses. You use the term ego dissolution, which I'm curious to break down a little bit more, because that probably is the kind of experience that many patients have. And then an integration process. So similar in some ways, but profoundly different in the sense of the use of a specific type of medication.
Yes. And profoundly different, especially on the day of the dosing day, that we're actually not, as therapists, we're really not doing a lot of talk with our clients. It's a very internal experience. They are facing trauma, conflict. They might be transported to 2,000 years ago, to their ancestors who may be going through metaphorically similar stuff that they're going through now, and out-of-body experiences, etc. A very wide range of experiences. Stanislav Grof, GROF, outlines a lot of these different types of experiences that come up during a dosing day, which means we have to be prepared as therapists because this is not stuff that we are super likely to encounter in everyday, certainly CBT sessions.
You're saying that the content of a psychotherapy session, when it's facilitated or like there's the assistance of psychedelics, can be profoundly different than the kind of content of conventional psychotherapy sessions. Yeah. I'm curious to understand, Richard, as someone who has facilitated sessions, what's that been like for you? What's that like to have someone take you to a place that is outside of the conventional kind of discussions that psychotherapy might revolve around?
It's a lot of sitting. So they say, sitters and co-sitters for reasons, because it is a lot of sitting. There is sessions where the person is very internal and very quiet. And then they come up for air at various times during like those 6 hours, and they'll discuss a little bit of what they've seen. And actually, unlike traditional psychotherapy, we're often encouraging them to go back inside, to face those things, that they can do that if they, honestly, it's a great example is like midwifing, in a sense. We're more of a midwife to their experience and whatever that can be. And it might be very different than what they originally imagined, but I find it always gives what the person needs. Maybe not always what they want, but they find what they need. And they find that is often gives more depth to what they need to cover in their life than what they even imagine. The plant is especially psilocybin, again, the plant that I have the most experience with, is a very generous guide in itself.
Right. It sounds like the sessions are rich and offer or afford possibilities that maybe conventional psychotherapy experiences wouldn't allow.
Mm-hmm.
Yeah. As we were kind of preparing and talking about this episode, that's maybe one of the things that we touched upon is the rationale behind the use of these medications. There was really a sense from both of us that maybe these medications solve a problem that our contemporary psychotherapy space is struggling with right now, that a lot of psychotherapy modalities really struggle to help everyone, or even to help anyone in some cases, and that there are real limitations to the degree to which we can really reach and support people through their experiences. I'm wondering if you want to share more about some of the opportunities that psychedelic assisted psychotherapy poses.
Yeah, I love that question. I think a lot of our models, especially if we're clinging close to Western medical managed care, insurance covered kind of models, can be very cognitive. So it's kind of a discussion about a discussion. And instead of going into how the trauma is stored in the body, even at a cellular level, and the release of that trauma, people have been holding on to trauma. Perhaps a clear example could be after a car accident, they feel locked in a certain position, they have a reduction in movement, and let's say the medical doctor has actually discovered that area is completely healed, yet they're frozen in that. It could be an example of certainly PTSD, where they're still having recurring memories, recurring dreams, flashbacks all the time. They're locked into the past, even if they've gone through a lot of trauma therapy. Maybe they've been through trauma therapy, maybe not, and medication, and hasn't been very, very responsive. They've tried a number of treatments and it hasn't been very responsive. So
Yeah.
the psychedelics give them that opportunity to experience something very different, and it blows past some of those limitations of traditional talk psychotherapy. We're working on a different level, that spiritual level, that somatic level.
Yeah. I'm just thinking about our previous discussion of kind of symptom management versus healing transformation, where we kind of critiqued the contemporary psychotherapy space as being inadequate, at least in the form most practiced by or within the healthcare system that focuses on a symptom management process. Yes. What I'm garnering from our discussion so far is that psychedelic assisted psychotherapy poses opportunities for healing transformation that even other modalities that emphasize that might struggle to reach sometime. When we talk about healing transformation, we're not talking about like an easy thing to get to. It's hard on a good day, but maybe psychedelics pose an opportunity to assist us in helping people to get to a place where they can radically reposition themselves and their outlook and perspective on life.
And the frame is different. The frame is that the person has within themselves, and I know, in humanistic client-centered therapy, we believe this, or we're supposed to believe this, but even there, we're still asking a lot of questions, and it's not a bad thing, but we're really connecting to the natural inner healer. This has been talked a lot about in psychedelics that's within the person, the natural inner growth potential, the natural inner healer that exists. And we're kind of getting out of the client's way versus, I'm the doctor, you're the patient. There's this power dynamic. There's this dependence on us as the healer. And this is a radical shift maybe the most radical shift isn't even for the clients, it's for us as therapists to realize all the ways, like really just regulating and being in the face of suffering and being able to be there for a person is, I thought I understood it before psychedelics, and now I get it on a somatic level of what that actually means. I don't have to be being a doer all the time.
Mm-hmm. We can really get in our clients' ways. Our stuff comes up. But I like that you also acknowledged that the power imbalance itself, the very way that we structure our healing system, imposes a kind of limitation that might actually prevent healing.
That we have all the solutions. The solutions are within the person themselves.
That's right. The implication of holding the healing within the doctor is that the patient can never, that we wouldn't look within the patient then for what might be there.
And it works really well in terms of capitalism, right? Because you have continued dependence, the person showing up for sessions and we're getting paid, but often again, we're facing these plateaus. This is one of the reasons why psychedelics is experiencing a renaissance and very needed, because of, again, we're experiencing these major plateaus and limitations of traditional pharmacotherapy and psychotherapy.
Yeah. I'm thinking about our previous discussion too. You made the just excellent point that part of what's attractive about these more contemporary or conventional forms of psychotherapy, and I would assume also the power imbalance, is what it does for us, the kind of comfort it provides us, the sense of ease, that a real genuine encounter with someone else is a tremendously vulnerable thing. And that practicing in a way that avoids that provides us and them a sense of security. What you're talking about, what we're talking about tonight, the profound and radical shift of that psychedelic assisted psychotherapy affords us, I could imagine would be scary. It represents a radical repositioning of ourselves as practitioners in relation to the client as well.
100%. Renaissance is a great word, but also it's a revolution because and we'll talk about that further in the podcast, but it is very threatening to highly capitalistic, high kind of command and control narratives that a lot of our current society is built on, destroying the earth, destroying community in a lot of ways. So if we're doing, I think, psychedelic psychotherapy right, connected with indigenous roots and a spiritual and ethical heart, that this may have a, traditional CBT or, give a prescription only kind of, there's going to be people realizing the limitations of those things more. And maybe some of those people will be out of work and some of the structures and systems may not be as lucrative.
You, as we were prepping, you gave kind of the example, I know it's in your mind, of psychedelics use in Silicon Valley for the expansion of creativity and productive capacity from these professionals. And if I remember, you were suggesting how it kind of has gone sideways on some people, that they were using it expecting to enhance their capacities, only to discover a radical repositioning that has gotten them completely out of the field entirely.
Yes, I've heard many stories about this.
Yeah, it's sort of as though that's what the medicine brings us. As much as we'd like to maybe control it for our own ends,
100%.
There's sort of a demand to work within its paradigm instead.
We're really like the ancient people, the first person to discover fire in a sense, and we don't know and understand the power thereof.
Yeah.
And ancient people, they've worked with it a lot longer, or traditional indigenous people, so they have a better understanding of the power of it and the respect for it, the sacredness of it.
I think one of the things that we alluded to at the beginning, which feels really important to acknowledge now, is that historically and in other cultural contexts, the use of these medications looked very different. It didn't arise as a kind of structured treatment within a healthcare context administered by a psychiatrist
No.
or a psychiatric nurse or a psychotherapist
Mhm.
in the interest of treating a disorder in the DSM. It was understood as medicine, and that there was a particular ceremonial context around the use of these medicines. And as I understand it, in many indigenous cultures, there was an understanding of medicine as its own entity, as its own spiritual entity.
Yes. Mother ayahuasca, etc.
Yes. Yeah, that you needed to come into relationship to, and that the relationship with the medicine, I should say, is instrumental, is essential in the process of deriving its healing qualities. You can't miss that piece. I think a lot of like historically.
You're giving me shivers. You said it so well. The relationship with the medicine, the relationship with the shaman, the relationship with the other people in the group, because very often it was a group or whole community healing process, critical. The medicine is a catalyst for community. I think that's one of the strongest examples that I've been reminded of recently. When we need it more than ever in our very isolated, individualistic world.
Right. Again, I'm thinking about the kind of opportunities that this medicine poses, the kind of transformation that it might bring in its widespread use. I think we both understand, though, that there's problems within this space, that there are potentials, not potentials, but that there are, like, we've been alluding to this. We've mentioned this is part of our location, but also I think as we really talk about this, we really need to acknowledge this and start these conversations, that if we're going to effectively incorporate this kind of treatment into our healthcare scheme, we might have to radically adjust the way that we practice healing, that the way that we currently practice healing is problematic, and that psychedelic assisted psychotherapy actually kind of highlights and illustrates some of those problems, that as we're working towards unfolding it as an available practice, we have to confront a number of things: the way in which we understand healing, issues of access and affordability, the limitations of our paternalistic medical system, and the concerns around appropriation.
Most of the problems that make it into the news, such as sexual abuse that happens, whether it's within a clinical trial or in other settings, when we're looking at that, and I'll mention a resource, The Ethics of Caring by Kalia Taylor, really designed and working with Stanislav Grof, a huge pioneer in psychedelics work and understanding in a spiritual context as well, the varieties of experience, that you're pointing to such a great, it's an important concept of when we have the ego, when we have a power imbalance, a lot of things that are inherent in the Western medical system, those are the undercurrents that drive the unethical issues that we see in the news and threaten to kind of take away, this wonderful opportunity for access to this very powerful medicine. So it's not, if we just look at it as, oh, this guy was just, this was a bad apple. And I hate that term. I think it doesn't help us actually understand what were the series of micro decisions that person made, and the context of where those decisions were located within, and the vulnerabilities. And there wasn't maybe enough accountability, support structures, questioning, all of this that then led this person, in a sense. And we have to be aware that this could be you or I or anybody practicing this. Anytime we think we're immune to an ethical issue, we're at most risk. That's what the research says.
Right.
So it's these contexts that you're describing. I love how you stated that.
Yeah. At the heart of this, I think, is that the vulnerability that is brought by these medicines creates the opportunity for healing. The power of this medicine is that I just don't want to say dismantle, but it helps us move around our defenses. It reconstitutes our defenses in a way where we can be directly connected to our experience. But then that leaves the patient tremendously vulnerable,
100%.
more vulnerable than they might find themselves in a conventional psychotherapy experience. And so the therapeutic possibilities of that are tremendous, but also the risks are much higher.
You stated it excellently.
I think it's good to highlight the extra ethical considerations that need to be involved in implementing this psychotherapy that our conventional perspective might not consider. If we're just looking at this as medicine, psychiatry has problems enough with informed consent. I could go on about the risks associated with antidepressant use that are almost never communicated to patients when they're prescribed them. It seems like this is another opportunity to address that concern, that patients need to be made aware of the safety risks involved in participating in this type of psychotherapy, the vulnerability they might experience, and that practitioners need to be really tapped into that as well and have a good sense of the need for safety, for extra effort towards safety.
Your informed consent game has to be Kobe Bryant level for sure.
Sure. Can you bring us into that from an experiential perspective, Richard? Because you've been there. What's that been like for you?
The best word is a process, that it is not just a piece of paper. We're discussing right from the first session. What is the cost going to be? How long we're doing this? Absolutely. Benefits and risks. There's risks for people. Right now, we usually screen out, except in very specialized clinical trial settings, things like bipolar disorder, even a relative that may have schizophrenia that may, because we know that there is a potential risk for psychosis or a psychotic experience that could be further destabilizing to the person, that we have to be very, very careful about the contraindications, really in tune to what the research is pointing to, really in tune to, again, the assessment, the history taking, the informed consent process of the amount they're taking, why they're taking that. And a big point is touch. Are they okay with the handhold or not? Under what conditions? That's where some of the, unethical issues that I've talked about have come up the most, that they are going to be in a vulnerable position, and preparing them so much with, even when they're ending the session, who's driving them home? Do they have a good relationship with that person? Where are they staying for that? And their whole integration process after that, they're supported around their work. They're supported hopefully in a community, in therapy. So every session of preparation, and I love to do, a minimum is 3 sessions, like bare minimum. I love to do, and I'm finding myself doing more and more on the prep side. And that's so important for preparing the nervous system. And I always say, even if it sounds like a stupid question, any question you have, the most smallest piece of concern, I want to hear it, because that is going to be, if we can hear it now before they're dosed, they can just focus on the things they need to focus on in the session.
Yeah. I hear the sincere concern in your voice as you talk about that process. And I'm garnering a sense of responsibility from you, Richard, an appreciation of the responsibility that comes with administering this type of therapy. I'm going back to what we were talking about earlier, how conventional forms of psychotherapy that are more information-based and skills-based, they recuse us of some of this, don't they? We don't have to be as concerned about informed consent, or at least we might fool ourselves into thinking we don't need to, because we're just exchanging information. Sure. The kind of relational contact we're making is so superficial that the risks feel low.
Yeah, may not be as likely to get into content. Certainly forms of CBT may really actually clearly state, we're not going into trauma processing. We're going into just maybe creating some safety and stabilization and coping behaviors and tools around. So we're going very often in the psychedelic experience, the client is going into it, and we have to be prepared for any number of possibilities and prepare them the best that we can.
Right. I feel like vulnerability is the hallmark word here tonight as we talk about this.
That's what I really want to get through. That's what the plant has made clear to me, that is something that, as I continue my own personal journey with psychedelics and with clients, is that I hope that can be something that I'm known for, and moving away from just a textbook understanding. It's important to look at research and to look at what great authors and people have been saying, but a heart-centered, intuitive, and relational place. This idea of relational ethics that Kailea Taylor is discussing. It's a bit different than maybe let's share a common ethical scenario and refer just to a particular ethics code. We have to go way beyond that to is this getting us closer to the kind of person, some things from virtues ethics, closer to the kind of person that we want to be and that we hope our clients would see us as, or our families would see us as? Or are we getting farther away from that with every decision we're making, even in the prep phase or from the first call with the person if they're deciding to explore psychedelic work?
I just feel like the stakes are so high as we talk about this, that that's maybe something that can't be said enough, that what we're talking about is something so potent that people can be radically transformed by this experience. They can be completely changed. They become incredibly vulnerable. I'm just really in contact with that or feeling that right now,
Yes.
that if we're going to practice this, if we're going to roll this out, we have to have an appreciation of the tremendous power of this practice and how high the stakes are, because this is not without risks, is it? This is not without risks.
No.
There are dangerous possibilities here as well.
It's like, and that has been a comparison by big people in the field, is that psychedelics is the equivalent of the nuclear bomb, or we should say nuclear energy, right? So nuclear energy has the potential to make atomic bombs. It has the potential to also power cities.
Right. I have thoughts or concerns about what this will mean for our work. Though as we're talking about it more tonight and really digging deep into it, my perspective is changing a little bit. But one of the things that immediately came to mind for me, seeing some of the research coming out of different institutions in Canada and the United States and Europe, and the tremendous effectiveness of this approach, like it just seems like so effective. And just in line with that, I first discovered psychedelic assisted psychotherapy in my undergrad. I was reading articles from the 70s. I was going back to Timothy Leary's lab. I was being a bit of a historian. I got curious.
Great to start there.
But I read case examples that were insane. People doing LSD assisted psychotherapy and their intelligence scores going up following the therapy. Not to mention people going through this therapy and, experiencing a complete cure of emotional symptoms of anxiety and depression.
Even physical symptoms at times. There is case studies about this.
For me, though, there's this issue of, will this be seen as a panacea? Is this a panacea? And I get concerned about some of the existential implications of that. Call me old-fashioned, Richard, but I actually like problems. I think problems are an important component of living. I think they're one of the inherent qualities of living. We all have to deal with problems all the time. And that is not necessarily a problem in and of itself. That's part of living, and living well is really having a connection to some of the basic conflicts that we find ourselves in just by virtue of existing. I sort of question, would this take that away? And would that be okay? What are we looking at here? Are we looking at people becoming enlightened and completely unburdened of any of the weight of their existence? Does this treatment pose an end, the possibility of the end of suffering as we know it? And on a more personal note, and this is kind of a silly thing to bring up, but I've thought about it, am I going to be out of a job in 20 years if I don't get myself schooled in psychedelic assisted psychotherapy?
Which question do we want to tackle first?
All of them. Answer all of them, Richard.
I have had a lot of thought about this. You and I, we have a great relationship because we really do like to go in depth into things and look at things from a lot of angles. And you're identify as Buddhist, and I maybe wouldn't go that far myself, but I have delved into Buddhism a lot, and I use its principles a lot and agree with many aspects of it. To deal with the first point, do psychedelics eliminate our problems? Certainly not. We just have different type of problems. Perhaps it's the problems of daily living that we're more meant to deal with instead of intolerable suffering. It has that potential, right? And we may still, or be able to better function still in the face of suffering, right? It's not going to alleviate death.
I'm thinking about this this term that's thrown around in psychoanalytic communities a lot, that psychoanalysis relieves a person of neurosis and brings them to a place where they can be just normally unhappy.
Oh man, I love sometimes looking at the analytical way of thinking. That is so interesting.
It's a sober position.
Yeah, sometimes we need to be sobered a little bit.
Analysis is not promising enlightenment. It's just promising a sober relationship with reality. You're saying that maybe that's would be the same with psychedelic assisted psychotherapy.
I would say there is, maybe people will crucify me for this, but I think if we actually connect to the spiritual nature, the relational nature of psychedelics, there is a potential. It doesn't guarantee enlightenment, certainly not. But there is a potential for enlightenment. And also in my studies of Buddhism, I took a really great course. Obviously, the most I learned about Buddhism is by actually just meditating and meditating with others. But there's a course that's widely available from the University of California, Berkeley, about the psychology of Buddhism. And enlightenment actually just means, hopefully, that we are in better understanding the nature of suffering, better able to be present with others in the face of suffering, more neighborly, more connected to others and community, helping others. Enlightenment requires practical action. Buddha never intended that enlightenment means you go and you get a really happy smile on your face and you're levitating around and in some type of, AI world or something like this. It is actually becoming more into community and helping. You cannot be a bodhisattva, enlightened person. You're not really truly enlightened if you are not regularly helping others also on that path to enlightenment, and knowing that probably it's not this graduation point where you get your certificate of enlightenment. It's a continual ongoing phase of, now I have this next set of problems, this next set of issues to deal with, this next set of an understanding of the true nature of suffering. Maybe I'm at the next level of that. So I can better, hopefully it results. I'm a very practical person and I love practical forms of Buddhism, where the final thing is that I'm better able to help others, help themselves.
That makes me think about Carl Jung's position, on healing work, which is that we're always just kind of chasing a new conflict. We never really get to a totally conflict-free space.
No.
It just becomes a question of continually leaning into whatever conflict.
And not being so afraid of it.
Yeah.
It has really helped me not be so afraid of conflict, so afraid of difficult questions, conversations, suffering. I have a bigger perspective that, those things, it's not that they're not important, but that things will be okay. Even the potential that even death will be okay.
Yes.
And this is really, traditional psychotherapy. I was certainly not getting to that level there, not getting that kind of understanding.
Right. Do you think, in light of having participated in psychedelic assisted psychotherapy, that you could still find benefit from a talk therapy?
Oh, yeah. I still regularly attend talk therapy.
Okay, yeah.
I probably attend it more.
That's interesting to me.
So you won't be out of a job, Glenn.
No, I'll be into a job.
You'll be more into a job. Because people...
I'll have many more clients.
They're now more comfortable in the vulnerability. I'm going deeper in therapy because there was that opening within the psychedelic experience. And when sometimes I notice that I'm getting more closed off or plateauing again, or disconnected from others, disconnected from my wife, etc., that it might be a good time for me to go back to therapy, go back to also into psychedelics, and the two complement each other and synergize, right? That they're greater than the sum of its parts individually, amazingly.
I like that. This idea that, well, not just that I'm not out of a job, but I think you're speaking to one of the qualities of this work, that in opening the door, we find ourselves then wanting more vulnerability and vulnerable connection, and actually prizing it more. The exposed state becomes the preferred one, or at least the opportunities of that exposure are understood and sought out.
Very well said. And that clicked something for me. Yes. Because those are the most authentic experiences, the experiences where I feel most alive, whether it's a conversation with you, Glenn, or my wife, or a student, where we are just experiencing one another putting our guards off to the side and how we each think about each other and our professional roles and experiencing, enjoying our somatic sensations, experiences of connection, which is inherently, I think, joyful. And is there pain in that too? Yes, but we can't experience joy without also pain. So we're better able to be immersed in it.
Mm-hmm.
I appreciate life way more after my use of psychedelics, of the so-called mundane, right? There's that idea of the profane, the mundane, and the sacred. Like there's these fine lines between things. So just playing cars, with my toddler, I enjoy way more, and have more empathy and understanding to what he really wants, right? It's obviously not so much about the cars. It's about I'm responding to him. I'm making eye contact with him. I'm cuddling him, whatever.
It's really giving some space for that. I think that's what you're saying is quite profound. You're really speaking of what this affords, Richard. And I think that what you're saying, again, is from a radical position. We're so often thinking about these treatments in the context of mental health, of eliminating DSM diagnoses. Do we ever think about the work that we do in the context of helping people enjoy life more?
I think we would have a lot more clients if we can shift to that positive psychology piece, right? Of just living, the art of living, the art of loving.
I think, though, that what's implied in what you're saying is that it took a radical shift in you. It took a facilitated shift for you to be able to stand in a position where the mundane is now seen as beautiful. That before you were in a position where that was more challenging.
Absolutely.
Yeah. Well, Richard, we've talked tonight about how there's so much to say on this topic that there's a need for 2 episodes. So this is going to be a 2-part episode because there's more that we need to say. Next episode, we'll dig more into some of the implications, profound implications, that psychedelic assisted psychotherapy might impose on the way that we approach healing work. And I think, Richard, that we're also going to be speaking more about our personal experiences with psychedelics, because I've had them too. And there's a lot more to say about what this can mean to someone, the assistance or the use of psychedelics, and the kind of profound effect it can have on a person. So we're going to give personal examples of that.
Excited and honored to discuss that.
Yeah, I'm looking forward to that as well, Richard. But for now, we'll say goodnight to our listeners, and we'll see you guys in part 2.
See you on the other side. We hope you enjoyed the podcast and are a little wiser for it.
Thanks for listening.